down the path to getting arthritis by any means. So with that being said, I always like to bring up my own personal injury story. And so I had knee surgery when I was in high school, and this was in 1986. It tells you how old I am. And it was the open procedure where they would, it was a ACL repair, MCL repair, and meniscectomy. And they didn't do it arthroscopically assisted. So that's where they kind of, you know, you had big incisions. Richard can see right now, I have a pair of shorts on. And
got a big gash.
Yeah. But I can tell you this, you'll be glad to know, 95% of my time, my knee feels 100%. So it feels great. I must admit, in the last 2 to 3 years, it has started talking to me, you know?
Okay. Yeah.
I'll go up and downstairs and I'm like, oh, I can hear that. Or I exercise actively, Richard can tell you.
Right.
And as I'm doing certain things, I may feel it. I may hear it. I don't feel it. It feels completely pain-free. I don't think it's a complete coincidence that that was my traumatic knee that had surgery and whatnot. So there have been studies that have shown that the noisy joint can lead to arthritis, but there are an equal number of studies that show it is not necessarily a problematic thing.
Okay.
With that being said, what's all important is always to strengthen above and below, and so the stronger the muscles are, the less pressure is placed on a joint, and you know, and that's what muscles are for. They are there to take pressure off our joint. So, so long story short, it is very, very common to have noise, you know, especially knees and shoulders. If it's a painful thing, that is not normal. That's a deal breaker. That should get evaluated, you know. So.
No, I'll tell you what, that sounds good, because that's consistent with sort of how we've thought about it, but not knowing with absolute certainty. That was a great explanation, Jeff. So yeah, thank you. Well, this question too sort of builds on that. Again, a common thing here, clients going through their workout, they've got just what I would call low to medium discomfort in a joint, maybe a soft tissue, and our general approach, Jeff, has been that we're looking for movement patterns that are pain-free, so we're able to pretty much do that almost all the time. But occasionally someone will insist that I want to just kind of keep working here, and so it's probably a threshold, I would imagine, in terms of when do you say yes or no. But when we think about pain during a movement or exercise, what's the best sort of view in terms of assessing what's the right time to stop or avoid, or you know?
And absolutely, and you know, in the physical therapy world, you know, we are treating body parts that are injured, that are symptomatic. One doesn't go to their doctor and say, you know, I think my quad's a little weak. I think I need some therapy.
Right.
They go to the doctor because they feel pain. So in the physical therapy world, we are often doing therapeutic exercise that certainly may be a little symptomatic. What our goal is to, what can we do to minimize those symptoms, you know? And you know, as an avid, you know, weightlifter, you know, someone who works out, I know there are times I will even perform certain things and you may feel a little bit with it. And so the first rule of thumb is, and we get this in the clinic as well, if someone is performing an exercise and there's pain, so the first thing we can adjust is the load that they're doing. So if it's a weight, we can decrease the weight a little bit. If it's resistance tubing, you know, maybe step a little closer or go for a lighter tubing. So that could be the first thing. We lighten the load, you know, for one. The other thing is, if they're going through a painful arc of motion, for example, if it's a shoulder patient and you're doing some front raises, and they get, you know, a little pain pinch as they get kind of towards the top here, then the next step is, let's shorten the range. We're still going to do the exercise, but we're going to avoid that painful pinch, you know.
Sounds good.
Don't plow through pain. And then the other thing, like you've already mentioned, is just ensuring that that exercise is being done with proper form. Are you recruiting other muscles around there that are helping to support, you know, that injured body part? So, you know, what I'll often tell patients, so there's nothing more frustrating for the patient and even for me as a clinician is when someone comes in and they say, oh yeah, I was weight training or I was doing my workout and I hurt something. You really hate to hear that because the intent is always so, you know, you're trying to do something proactive and good, but you know, I could tell you, I've been in your shoes. I've done that same sort of thing before where I've been trying to work out and I hurt something, and it's you know, kind of a little bit of the risk we play, but it's still it is still important to continue the exercise, find a way to do it, lighten the load, shorten the range, make sure the form is good, and not completely stop, you know. The other strategy is, of course, you know, if it's the shoulder that's being affected, then all right, let's maybe steer away from that a little bit and let's concentrate on lower body a little bit. So that movement is medicine. Even it's therapeutic for, you know, a sore shoulder, which the shoulder is not just one joint, there's really 4 joints that make it up. But there's benefit for someone to get on a stationary bike for a shoulder. If I'm on a bike, even my posture muscles have to work a little bit. So yeah, to your point, you don't want to, we don't want to ever shut down completely. We want to find a way to continue to do it. So
that's great to hear, Jeff. Would you say, just as a small footnote, that I think maybe years and years ago, I've read in different books where physicians may have taken the approach of saying, okay, you have an ache, stop doing all activity, but that is sort of maybe 1970 or 60 or something like that.
But I tell you, you know, you still hear some things out there where someone will say, oh yeah, is getting on the bike gonna increase my arthritis? No, it's gonna it's gonna help it, you know. So yeah, you still will hear some kind of myths out there that we just need to keep squashing them.
Okay, all right, good, excellent. Now that's very consistent with how we sort of treat the exercise in terms of the load, the range, substitute movement, lower body, etc. So I'm glad to hear that. That's really good news. Now, number 3 is about muscle strain. So we, as you can imagine, our clients are active. They're doing other stuff. They're often here because they want to stay active and recreate and so on. So they may come in and may have strained a muscle, and so you know, of course, they're anxious to work out, and sometimes we're thinking, well, maybe we should skip that exercise today or let things calm down. So as a sort of a simple rule of thumb, if you have a strained muscle, what is the sort of the simple for the first couple steps for self-care?
Yeah, and this isn't earth-shattering by any means, you know, that acute, pure muscle strain. Muscles are well innervated. They get a great blood supply, and so they heal very well. You know, it really just depends on how severe the muscle strain is and kind of where it is. So, you know, first and foremost, I'll just say, you know, if it looks like something severe, it probably is worth getting checked out. Because the last thing you'd want is, you know, the grade 2 muscle strain to turn into, you know, a tendon rupture or something like that, especially if someone's compensating. But I could tell you, even just to, you know, rest for a day or two from doing, you know, that particular, so if someone comes in and they strain their biceps, to just hold off on that for a day or two, just stay away from that, and, you know, ice, compression, you know, if it's certainly a joint, you know, elevate, but, you know, just to try to support it that way. Yeah, it doesn't need to be a complete shutdown by any means, but, you know, that's where the evaluation of a muscle strain is helpful, because certainly a muscle can be strained to the point where, you know, fibers of that muscle get torn, and it could result in, I mean, it's obvious, you see swelling, sometimes even bruising, depending on that area. So, but yeah, muscles are, if it's a pure muscle strain, they're very, very recoverable, very fixable, but you know, we just don't want it leading into something, you know, that could be a little more traumatic. And you know, what I always tell my patients is, we really want to minimize the setbacks. We don't want to have to, you know, increase your time on the IR list, the injury, you know.
Yes. So. Indeed, I'm with you there. That's right. How would we think, so is it accurate to say that with an acute injury of some kind of a muscle strain, that typically ice is your first go-to. That's not when you're dealing with heat at that point in time?
Yeah, absolutely. So the reality is ice and heat, they both work superficially. You know, our body is between the skin and, the epidermis and the skin and the muscles, it's like a suit of armor, and so ice and heat, they really do work superficially, in that the body tries to keep our temperature at 98.6, so if I put a cold pack on my elbow, my body says, hey, wow, this is cold, I'm going to send blood flow to that area to kind of warm it up, because it's trying to keep that everything at 98.6. And then if I put a hot pack on my other elbow, it says, wow, that hot pack, that's 150 degrees, that's really warm, we're going to increase blood flow to that area to superficially make that feel a little cooler, So they really, on a superficial level, kind of work on the same thing. But I can tell you, for that acute injury, ice is really a better pain analgesic. I kind of like with that acute injury, it'll calm things down. Certainly, if it's an area that looks a little swollen, just to put an ice pack on there, just a little compression on there can even kind of help facilitate that swelling. So, but yeah, that's always a good rule of thumb. So
it's safe to say that really, if you're not sure, you're never going to harm yourself with ice.
Yes,
a little
and
bit of ice.
the only time I guess never say never.
Yeah.
If someone has a vascular condition, if they already have limited blood flow in their feet and they roll over their ankle, that'd be one of those things you would want to kind of consult your physician. But that's just the
Sounds
lawyer
good.
and me talking.
So, yes, absolutely, absolutely. So, all right, good information. So, let's say you have that strain, and you did you felt like, okay, I need to take a week off, kind of let it calm down a little bit, and maybe I wasn't training at MedFitness for a week. When you return to your strength workout, or even return to training that area of your body, should you anticipate, is your rule of thumb to say, I'm looking for almost no discomfort in that muscle, or just a little bit initially? Is that too narrow of a question? Or
No, not at all.
Okay.
I think it's a great question, and that is the struggle sometimes, and you see it at all walks of life. You'll see it in the weekend warrior. You'll see it in the person that works out 3 times a week. You'll see it in the professional athlete. That's the struggle. Like, how do you get them to that next level? So, when one starts to increase demands, so you've had an injury, you've laid low for a little bit, swelling, the acute pain has gone away, and then it's time to kind of get back. So you're going to gradually start to resume some of those activities. And some of the things we already talked about, do that exercise in a pain-free range, lighten the load, don't jump in the deep end and just resume where you left off. But I think it is very safe to say that, if someone's going to do a little more activity, they're going to probably feel it a little more, It shouldn't be, overly painful while you're doing the activity, but certainly afterwards, that can be the case. I'll see this in our back patients all the time, and this is, of course, where the good history and trying to be in tune and being in tune with your body, but oftentimes we may add an exercise or two to our back patient, and they'll do it and it feels fine as they're doing it, and when they leave it feels good, and then they may come back a day or two later and they say, that exercise really made me sore. And then we do the deeper dive to say, all right, was it sore was it sore afterwards? What you really got to realize is everything we do during our day can have an effect on, a knee, a shoulder, a back, So it's those sort of things, but
it's the totality. We hear that a lot, Jeff. Gosh, people do something and they think that maybe it was something that tipped them off here, but they're doing a lot of other stuff.
Exactly. We're sometimes we're biased and kind of thinking that, but and they may be right, but it's sometimes
Yep.
a little tough to determine that completely.
Okay, here's one that's been around forever, which is wearing a brace on a joint or body part when you're working out. And now, of course, what's new is the kinesiology tape. And so, first, let's tackle that sort of brace issue.
Sure.
We don't
Mhm.
have a ton of clients who do it, but some do. And how should we think about that?
And, I
Is
mean,
it-
they look cool. You want to look like J.J. Watt with the big
That's
elbow brace,
That's
right?
Yes, you look good. Yeah, right. You're impressive. Right.
But no, I think we'll have patients that feel like even like a neoprene sleeve on their
Right.
knee.
Right.
It gives us some compression. It may not give it the joint actual stability, but it may, stabilize their patella, their kneecap a little bit. And the first thing they'll tell me is, it feels better when I do it, so
Yeah.
no harm, no foul.
Right.
Same thing with an elbow brace or, a shoulder support. To me, like if it allows someone to do, those particular activities with, greater form, if they, feel less discomfort with it, by all means,
Okay.
for sure do that.
Okay.
I'll often discourage them, if they use it when they're working out or even doing heavier activities at home, that's okay.
Yeah.
But I would say, when you get home, take it off,
Yeah.
like let it breathe,
Okay. Okay.
Very seldom do you want someone sleeping with, something
Yeah,
like that.
something like that, okay.
Regarding kinesio tape,
Yeah.
and we use McConnell tape is another one that, has been around for a long time, but,
Yeah.
it's the same sort of thing. Those structures, the kinesio tape can provide just almost like a little better muscle awareness. It can help, just postural muscles kind of wake up a little bit. To me, it's not the magic panacea that will suddenly make, a step up, completely pain-free,
Mhm.
but to me, you can't argue with just the feeling of, hey, this does feel a little better.
Okay.
This is probably 4 or 5 years ago, I signed myself up for a kinesio tape course just because
Yeah.
I had to
Sure.
see, all right, am I really gonna buy into this? And
Right.
we taped every body part,
Yeah.
in this class, and the first thing you learned was, if you're gonna tape, you have to have an intent, You're just not throwing tape on for the sake of doing it.
Yeah.
So many times, you'll see examples where, someone's just gone through a roll of tape and they
Yeah.
could have lasted them 3 times as long.
Yeah.
Less is more, and
Okay.
but it really can be effective. There are some really neat, even interweave techniques where you can take that kinesio tape and kind of cut it. They call it fingers, and I tell you, I wouldn't have thought it unless I tried it. I had a patient post-op knee replacement, and he was really swollen, and he had just a ton of bruising.
Mm.
And so we did that little finger technique, and just got it kind of on his knee. And he came back 2 days, and I told him, you can keep it on for a couple of days, as long
Yeah.
as it's not irritating the skin.
Yeah.
He comes back, and we take it off, and you can see where underneath the fingers of the tape, the bruising was removed,
Wow.
and so it looked like a kind of a cool tattoo.
Interesting.
He
Yeah,
kind of
right,
liked
right.
it,
Yeah, gosh.
and I tell you, I wouldn't have thunk it until I saw it with my own eyes. So,
Okay. Yeah. Okay.
it's got some. It definitely has some use. So
Okay. And
For
so
sure.
that can now, when I first started seeing it, I thought, well, oh geez, they must have gotten that with their physical therapist or medical professional. Now you can buy that and do it yourself, is that right? Or-
Absolutely, yeah,
okay.
yeah, and of course,
Okay. And
you know,
there's where it
YouTube
might
is
be a little sidetracked if someone's not doing it appropriately, so.
yeah,
Okay.
mhm.
Okay.
yeah, and there's all sorts of instructional videos on how to do it.
Right, okay.
You always want to look at the source to see.
Yes, yes. Where'd you get that from? Yeah, right.
Right.
All right, good. No, good advice, Jeff. Now, here's another common one. Number 6 is this whole issue of post-surgery. So we're very good about asking our clients to say, Jeff, what did your doctor tell you should do? What did your physical therapist tell you should do? So I'm sure you all agree that's a good practice, and we're more than happy to support and follow their recommendations. But in general, we see a lot of clients with new knees and new hips as well, and sometimes they'll say, well, they didn't tell me anything. And so whether
And
that's true or not.
I
right?
tell you, that is very true. There are
Right.
times,
So-
and we have to remember too, someone may be in their post-op doctor's visit, and how many times have you been listening to a lecture? Hopefully it's not
Right.
happening here,
Right,
where
right.
people are talking and you're like, I just kind of zoned out there for
Right.
a little bit. What one is being, what's being processed may not,
Right.
be what is being said. So, so there could be some truth to that. And,
Yeah.
but regarding like total hips, for example,
Yeah.
it is important to know surgically what the approach was done.
Okay.
So a hip can be done with a anterior, where they kind of cut into the fibers of the ligaments in front. They're very strong. And then there's also they call it the posterior lateral approach, where it's kind of just on the side of the glute, the hip rotators. That cuts into a little more muscle. There's a few more precautions with the posterior lateral approach, where you don't want a lot of hip flexion above 90 degrees, especially early on. We don't want that leg crossing over. We also don't want what's called internal rotation. That would be the foot kind of turning in, because that can put a strain on those muscles behind there.
Okay.
And I'm talking early, post-operative. I mean, I know some doctors they may say for 2 months, they just don't
Yeah.
want those things, but
Yeah.
6 weeks is usually the immediate precaution time. Regarding the anterior approach, there aren't as many precautions, and I've heard some doctors tell patients, there's no precautions with it. I would still be a little cautious of stretching that hip kind of, backwards here, and that's hip extension.
Yeah.
So, like for example, like backwards walking, one
Yeah,
would
yeah,
have to be a
yeah.
little careful with.
Yeah.
The other thing I tell, like total hips and even total knees, it's the pivoting sort of motions that can be just a little worrisome, The total knee, it'll just be painful, so it won't feel good. But total hip, that's where, that ball can be rotated in the socket a little bit. And definitely with that posterior approach, that it's the internal rotation that can put more pressure on it. A lot of, the person that gets a total hip oftentimes is someone who enjoys golf,
Yeah, right.
And
right.
I've heard doctors tell patients, all right, I'll allow you to golf, but for the first season, I don't want you to use golf shoes. I want you, nothing with cleats,
yeah.
because they want your feet to have a little more
Right.
movement in there. So,
Makes sense, yeah.
I often make that same suggestion.
Okay.
So,
Okay.
so.
All right. Sounds good. I mean,
Yeah.
we're cautious with those folks and make sure they're always feeling good and nothing is tipping the card and so on. But that certainly helps us to round out how we're thinking about those particular
Yeah.
issues. So 'cause
Mhm.
those are more nowadays, more and more common. Someone just asked me the other day, how come hip replacements are so common these days? Well, we're getting older. Medicine is better.
Well, and I tell you, and the
yeah.
satisfaction rate with hip replacements and knee
Yeah.
replacements, it's
Yep.
phenomenal. So,
Yeah.
and they're doing them on patients that are younger and younger. So,
Yeah, it's amazing, amazing.
so-
So, all right, very good. So number 7, Jeff, our last question here is about sort of Athletico and using your expertise. So I know that you do some injury screens with folks that
Mhm.
are concerned about something, and they
Sure.
can meet with a physical therapist and be evaluated. What should we know about that?
Yeah.
How does that
So
work?
all of our
Yeah.
clinics, and we're, throughout the suburbs and Chicagoland, we offer free injury assessments. There are a couple of carve-outs where we're unable to do those, but
Yeah.
we can always talk about that with, the person who calls. So they'd be welcome to call any of our clinics. The other thing that has happened, and this is actually 2 years now in the state of Illinois. I've been a therapist for 29 years, and I can tell you for a long time I didn't think it was going to happen, but it finally did 2 years ago. It's called direct access, and I think there's about 15 states now that allow it. And that's where one can see their friendly neighborhood physical therapist without a script from a physician in most cases. Again, there's a couple of carve-outs that, keep that from happening, but for the most case, what that does, it allows you just sooner, getting that injury addressed, as soon as possible, so you can get back to doing what you love to do. So,
Absolutely. So that's good. Is that good for patient care, just to have that direct access to a therapist?
it is, and
Okay.
and especially, so I've been in the area for a long time, and I'll have, you have patients that have had that, injury that, sometimes just needs a little tune-up here and there, where they don't necessarily need to follow up with their doctor, get films and all that.
Right.
Because even the doctor will say, go to see Jeff at Athletico.
Yeah,
So,
right.
so it's just nice to have that quicker access, and it just
Okay.
gets the ball rolling.
Yeah.
Our goal is to cure you, to get you better, so we, don't have to see you back in the clinic. And
Yeah.
the sooner the treatment is implemented, the sooner that happens. So.
Yeah, yeah, excellent. Well, that I can't tell you how useful that resource and that option is, because left to their own devices, a lot of people, they won't go see their doctor. And
Yeah.
so just to be able, I'll often tell them, you have access to a professional who can give you solid advice right off the bat. So
Yeah,
so-
yeah, and what happens to all of us, you'll mention something, and then all of a sudden, all your friends, your neighbors, they'll tell you, oh, let me tell you what you need to do for your knee.
Right.
You gotta realize,
Right.
their sample size, N=1. They are basing that on
Right.
one situation, and so,
Yes.
you know.
A mountain of evidence, yeah, right, exactly. Well, Jeff, I greatly appreciate your time tonight. It's good to see you. Of course,
you too.
We've known Jeff, MedFitness has had a relationship with Athletico for quite a few years now, and so I've gotten to know Jeff, and his team over there here in St. Charles are phenomenal. So yes, we appreciate your time. And this video, just so if you're wondering, guys, if you are not on Facebook like some of our clients, which is where we are right now, this will be available to view at our website at medfitnessprogram.com/blog. That's our learning center. We will put our articles and educational videos, and this video will be there if you want to go review it, re-listen to something. Maybe you tuned out and you missed a little nugget from Jeff. You can review it, or you can share it with friends and family, because it's just practical, useful information that everyone can benefit from as well. So thanks again, Jeff, and thanks for being here tonight, guys. I look forward to seeing you next time.
Thank you.